Welcome to Healthy Living Every Day, your companion on the journey to a healthier and more energetic life. Subscribe to the channel today so you won't miss simple yet effective health tips for everyday living. And now, let's dive into today's important topic, silent symptoms of weak kidneys you may overlook. Many people believe that kidney problems always come with obvious warning signs, sharp pain, visible swelling, or severe changes in urination. But in reality, kidney disease is often called the silent killer for a reason. The kidneys can be quietly deteriorating for years without showing clear symptoms. By the time the problem becomes noticeable, the damage is often advanced and much harder to treat. That is why understanding the silent symptoms of weak kidneys is absolutely critical. In today's presentation, we will uncover the subtle, everyday signals your body may be sending, signals that are easy to overlook but could mean your kidneys are in trouble. These signs include constant fatigue, changes in urine, puffy eyes, back pain, and even skin issues that you might dismiss as something minor. Each of these silent warnings can reveal what is happening deep inside your body. Stay with me until the end of this video, because catching these signs early can help you take action before kidney disease becomes severe. Awareness and prevention are always more powerful than late treatment. So, let's begin by understanding why the kidneys are so vital and how they quietly affect nearly every part of your health. Role of the kidneys. Your kidneys are about the size of a fist, located on either side of your spine. Though small, their functions are extraordinary. Each day, your kidneys filter around 50 gallons of blood, removing waste products, balancing fluids, and regulating electrolytes like sodium, potassium, and calcium. They also control blood pressure, stimulate red blood cell production, and keep bones strong by maintaining vitamin D levels. When kidneys weaken, toxins build up in the bloodstream, leading to subtle but dangerous health changes. The challenge is that these early signs are often vague, feeling tired, changes in appetite, or skin problems, that people blame on aging, stress, or other conditions. Because the kidneys work silently in the background, problems can go unnoticed for years. By the time obvious symptoms appear, kidney function may already be reduced by 70 to 80%. This is why learning to recognize early, silent symptoms is so important. Your kidneys will not send out loud alarms, but they whisper through small changes in your body. If you know how to listen, you can protect them before the situation becomes serious. Symptom 1, constant fatigue. Do you often feel exhausted, even after a full night's sleep? Fatigue is one of the most common but overlooked signs of weak kidneys. When kidneys are damaged, they cannot properly filter waste and toxins from the blood. This buildup makes you feel sluggish, heavy, and drained of energy. Additionally, weak kidneys may not produce enough erythropoietin, a hormone that stimulates red blood cell production. Without sufficient red blood cells, your body develops anemia, leaving less oxygen available for your muscles and brain. As a result, even light tasks may feel exhausting, and concentration becomes difficult. Many people brush off constant tiredness as stress, poor diet, or lack of rest, but if fatigue persists despite lifestyle adjustments, it could be an internal warning. Pay attention to the kind of fatigue you feel. Is it temporary, or is it a deep exhaustion that lingers every day? If it's the latter, your kidneys may be silently calling for help. Don't ignore this symptom, get your blood and urine checked, because early detection can prevent long-term damage. Symptom 2, puffy eyes and swollen ankles. One of the earliest visible signs of kidney trouble is fluid imbalance. Healthy kidneys remove excess water and sodium from the body. When they weaken, fluid builds up in tissues, creating puffiness around the eyes, especially noticeable in the morning, or swelling in the ankles and feet by evening. Many people attribute this to a salty meal, standing too long, or simply aging. While these can be causes, consistent puffiness or swelling may reveal an underlying kidney issue. Puffy eyes, in particular, can indicate protein leakage in urine, a condition called proteinuria, which signals kidney damage. Swollen ankles might also be mistaken for heart or vein problems, but kidneys are often the hidden culprit. The key is persistence. If you notice swelling that doesn't go away, worsens over time, or is paired with fatigue, it's time to pay attention. This is your body's way of warning that your kidneys are not effectively balancing fluids. Never ignore these subtle visual signs, they may be the first clue to protect your kidney health. Symptom 3, changes in urination. Urine is the clearest window into kidney health. Silent kidney problems often reveal themselves through small changes in urination patterns. This may include urinating more often at night, a significant reduction in urine volume, or the presence of blood. Foamy urine is another overlooked symptom, usually caused by excess protein leaking into the urine. People often dismiss these changes as minor, perhaps due to drinking more water, aging, or temporary infections. However, when these changes persist, they are strong indicators of kidney dysfunction. Blood in the urine, for example, may come from damaged kidney filters, while frequent night urination can signal reduced kidney concentrating ability. Always pay attention to urine color, frequency, and texture. Your kidneys are directly reflected in these changes, and ignoring them could delay diagnosis until it's too late. A simple urine test can reveal hidden problems early, long before severe damage occurs. Remember, urine never lies about your kidney health. Symptom 4, persistent back or side pain. Kidney pain is often subtle, not sharp like muscle injuries. It usually manifests as a dull ache on either side of your spine, just below the rib cage. Unlike muscle strain, this discomfort doesn't improve with stretching, massage, or rest. It lingers, and sometimes intensifies at night. Many dismiss it as back pain from sitting too long, but kidneys located in the same area can cause these sensations. Pain may also signal kidney stones, infections, or chronic kidney disease. If you experience persistent discomfort in the lower back or sides, especially combined with urinary changes, it's wise to consult a doctor. Waiting until the pain becomes severe can allow the condition to worsen silently. Don't confuse kidney-related pain with common muscle soreness, the difference is persistence and depth. By paying attention to these subtleties, you may catch kidney problems early. Symptom 5, dry and itchy skin. The skin often reflects internal health. When kidneys cannot balance minerals and remove toxins, waste accumulates in the blood, causing itchy, dry, and flaky skin. This discomfort is often dismissed as seasonal dryness, allergies, or simple dehydration. But in chronic kidney disease, itchy skin is not just a cosmetic issue, it is a systemic warning. Imbalances in calcium and phosphorus contribute to this irritation, which worsens at night and affects quality of sleep. Patients often scratch so much that the skin breaks, increasing infection risk. Unlike normal dry skin, kidney-related itching is persistent, difficult to soothe, and often resistant to creams or lotions. If you find yourself constantly scratching without relief, and especially if it's paired with other symptoms like fatigue or swelling, don't ignore it. It may be your kidneys signaling distress. Symptom 6, shortness of breath. Weak kidneys can create breathing difficulties in two ways. First, they may not produce enough red blood cells, leading to anemia and reduced oxygen supply. This leaves you breathless even after light exertion. Second, failing kidneys allow excess fluid to accumulate in the lungs, causing a heavy, suffocating feeling. Many mistake this for asthma, aging, or lack of fitness, but it may actually be kidney-related. Shortness of breath that appears suddenly or persists without clear cause should never be ignored. If you notice difficulty breathing while lying down, or frequent waking at night gasping for air, it could indicate fluid buildup from weak kidneys. Because these symptoms resemble heart or lung problems, people rarely suspect the kidneys. But understanding this hidden connection may save your health. Always investigate unexplained breathlessness. It is not just a sign of aging, but possibly a signal of silent kidney failure. Symptom 7, loss of appetite and metallic taste. Kidney dysfunction causes waste buildup in the blood, a condition called uremia. This directly affects taste and appetite. Many patients report a constant metallic taste in their mouth, making food unappealing. Meals that once brought joy suddenly taste bitter, leading to loss of appetite, weight loss, and malnutrition. Families may think their loved one is simply stressed or aging, but in truth, toxins are altering their sense of taste. Over time, lack of appetite weakens the immune system, leaving the body more vulnerable. If you find yourself losing interest in food, struggling with persistent bad taste, or unintentionally losing weight, don't ignore it. This subtle change could indicate kidney weakness. Simple blood tests can confirm if waste levels are too high. Ignoring appetite loss can accelerate health decline, but catching it early offers a chance to intervene and protect kidney function. Why these symptoms are overlooked. Why are kidney problems so easily missed? Because each symptom can be explained by something else. Fatigue may be blamed on stress. Swollen ankles on too much salt. Back pain on sitting. Dry skin on weather changes. Shortness of breath on aging. Loss of appetite on stress. Individually, these signs seem harmless. But when they occur together, especially over time, they paint a dangerous picture of weakening kidneys. The silent nature of kidney disease makes it one of the most underdiagnosed conditions. By the time people seek help, kidney function may already be reduced by 70% or more. That's why education and awareness are so important. Don't wait for loud alarms, listen to the whispers your body sends every day. They may be easy to dismiss, but they are the body's way of asking for help before it's too late. Protecting your kidneys. The good news is, you can take steps today to protect your kidneys. First, monitor your blood pressure and blood sugar, as hypertension and diabetes are the top causes of kidney disease. Second, stay hydrated with the right amount of water, neither too much nor too little, depending on your doctor's advice. Third, adopt a balanced diet low in processed foods, excess salt, and sugary drinks. Fourth, avoid overusing painkillers and unverified herbal remedies, as many harm the kidneys. Finally, schedule regular health checkups, especially if you are over 40, have diabetes, high blood pressure, or a family history of kidney disease. Early detection through blood and urine tests can make the difference between manageable treatment and life-threatening complications. Protecting your kidneys doesn't require extreme measures, it requires consistency, awareness, and smart choices every day. Conclusion and call to action. Kidney disease may be silent, but your body is never completely quiet. Persistent fatigue, swelling, changes in urine, back pain, itchy skin, shortness of breath, or loss of appetite are not random, they are warnings. By recognizing these silent symptoms early, you give yourself the chance to protect your health and preserve kidney function. Don't ignore the whispers until they turn into shouts. If you or someone you know is experiencing these signs, consult a doctor immediately. Share this video with family and friends, because awareness is the key to prevention. And remember to subscribe to this channel for more health insights, so you never miss important knowledge that could save your life. Protect your kidneys today, and they will protect you for a lifetime.